So welcome. Thanks very much for coming and taking time out of your schedule tonight. What we'd like to do tonight is give you a bit of background on what we do at the South West LHIN, but also talk about healthcare here in Elgin County. We've got a number of guest speakers that are going to give a short presentation on some of the aspects that they have responsibilities for. I'm Mike Barrett. I'm the CEO for the Southwest Local Health Integration Network. How many people have heard of the LHIN before? Oh, good, good. Anyone not? Oh, so welcome. And tonight is a chance for us to engage the community here in Elgin County. We had our board meeting from 2 o'clock till 5 o'clock today here in one of the boardrooms in the St. Thomas Hospital. Then we had a board-to-board engagement session, so from 6 till 7, we had board members from organizations that we fund from across this geography talking about board issues and governance issues, and some of you have stayed, some of the board governors have stayed tonight. And then tonight's session is really about engaging the public, so giving you an opportunity to talk about, or to hear about healthcare in Elgin County, then ask some questions. And please, as we go through these presentations, they'll be fairly quick. But if you've got questions to any of them, or to us, or to our board, please ask them, because that's part of the richness of this dialogue, is to allow the opportunity for you, each of you, to ask questions. Just gotta get the clicker here. So maybe to kick things off, who is an Elgin County resident here? Okay. How about Oxford County? Middlesex? Hi, Shirley. Any places I've missed? Hey, how many board members are here? Great. Members of the public? How many of you work for health service providers? Good number as well. So it's a good mix of people tonight, and you're going to hear a variety of presentations that hopefully will give you a better glimpse of healthcare here in Elgin County, and hopefully you'll go back a bit more knowledge in your back pocket, if you want to say that, when you leave this evening. I'd just like to recognize our board. We have a number of board members here. Our board chair, Jeff Lowe. Jeff is at the back. So Jeff is former board chair for London Health Sciences Center back probably a number of years ago, and is now the board chair with the Southwest Local Health Integration Network. So hopefully I can get everybody picked off here. So Robert Wood is from London, former board member at St. Joseph's Healthcare in London. Ron Bolton, and I always tell this story when I introduce Ron, is that he's from St. Mary's, lived on a farm outside of St. Mary's, and I lived in downtown St. Mary's. Between him, his brother, and his father, they've served over 50 years on the board of directors for the St. Mary's Hospital or the Here in Perth Healthcare Alliance. So long history of board governance, and now we're lucky to have him here on the Southwest LHIN board. Barbara West Bartley she must have left. Jerry Moss, I think Jerry and Barbara just left. And Ron. And Ron lives at the geography that we cover stretches from Long Point in the south to Tobermory in the north. So our board members, one's from Wyerton, one's from Southampton, one's from Annan, which is outside Owen Sound. So we've got a large geography to cover. Linda Stevenson, hometown person from St. Thomas, and Linda's been a longtime board member with us. Her terms are up shortly in the month of May, and has been a former board of directors on the Thames Valley District School Board. Now, who am I missing? I think I've got everyone. Okay, so welcome to our board, and thank you all for coming tonight. As I said, there'll be an opportunity for questions and answers following the presentations. Your feedback's important, so we've redesigned this session a number of different times to make it more appealing and more appropriate and helpful for you coming to attend these sessions. So please fill out those feedback forms. And we are videotaping the session tonight, and you'll say, well, why are you videotaping something like this? What we've found is that people often say, well, we don't know about the LHIN, what do you do? And you need to communicate more. And so what we've done, anytime we do a presentation now, whether it's something like this or a provider doing a presentation, we videotape it and then we put it on our website. And our website is linked into YouTube. And our YouTube website last summer was the highest ranked not-for-profit YouTube site in Canada. Yeah, so And thanks to our communications team who's here tonight doing this. Lots of good videos on there, and if you have an interest in anything that we've talked about over the last number of years, it's on there, and it certainly is a good communication tool for us. So, I'll just give a quick overview of the LHIN, and then we'll get right into the panel presentations. As you can see, the geography that we cover stretches from Long Point in the south up to Tobermory in the north, includes a portion of Norfolk County in the south here, as well as Elgin and Oxford and Middlesex. We're bounded on the west by Chatham-Kent and Lambton County. We're one of the largest LHINs if you compare us to some of the other 14 LHINs across the province, much larger geography. And obviously, that larger geography is, we want to make sure that we stay in touch with the people that we have responsibilities to. So our board meeting today was in St. Thomas. Last month it was in London. The month before it was in Mitchell. We've been in every corner of this LHIN in terms of having our board meetings. We've been in Port Rowan, we've been in Elmer, we've been in Tobermory. So we move our board meetings around to make sure that we stay connected to the people that we serve. A large urban population with the City of London, large proportion of seniors, and even you see our LHIN bounds Lake Huron and Georgian Bay. There's a significant migration of people to the lakeshore for retirement. So it creates challenges, and it's with seniors coming to those communities looking for services very similar to what they've had in other parts of the province, if it's in the GTA. So lots of seniors moving in, and obviously along Lake Erie as well. 5 First Nations reserves, 3 in the south and 2 in the north, and then we have a French language services designation. So we, in the South West LHIN, have responsibilities for $2.1 billion. So with that $2.1 billion, we fund over 150 health service providers. Those health service providers include 19 public hospitals on 32 different sites. So that includes I always say the big hospitals like London Health Sciences Center and St. Joseph's Healthcare in London, but also a number of other community hospitals like St. Thomas Elgin General Hospital here in St. Thomas. And there's also one private hospital in the city of Woodstock, which is it's a 16-bed hospital. We funded about $890,000, and it operates more like a long-term care home than a hospital, but it's one of the few private hospitals that remains in the province of Ontario. One Community Care Access Center, and Gordon Milak is here. He's the Senior Director with the Community Care Access Center. You're going to hear more about them tonight. 62 community sports service agencies. So that includes organizations like BON, Meals on Wheels. We have 62 of those. 28 mental health agencies, so that includes CMHA Elgin, which Heather DeBruyn is here tonight, and you're going to be hearing more about that. 9 addictions agencies, 5 community health centers, and again, you'll hear more about a community health center here in St. Thomas with Judith. And then 76 long-term care homes, and there's one more coming to the City of London in the next year or so. So as I said, our allocation is, this slide is actually out of date, our allocation is $2.1 billion, just over $2.1 billion to that we fund the 150 health service providers in our area. Our budget, for our operational budget, is $5 million. So if you look at how much money we spend as an organization compared to the money that flows out to our health service providers, 99.75% of all funding that we receive flows out to our health service providers. Places like the Community Health Center, the hospital, the CCAC. I've already done the introductions of our board of directors. Our board of directors are appointed by order and council appointments. So these appointments come from the Government of Ontario. There's 14 LHINs across the province. All of the board of directors at each of those 14 are appointed through the OIC process. I've gone through the list here of people that are on our board. And the one that I did forget was Cheryl Fagan, and Cheryl actually participated in our board meeting today by teleconference because she was in Goderich, and she's a lawyer in Goderich, and she had court work today, so she had to participate by teleconference. A very small staff complement, so we have 33 staff. Those 33 staff have responsibilities for that large geography, the large number of providers, so we're kept very, very busy. There's a number of us here tonight, and it's not unusual for us to be out 2, 3, sometimes 4 nights of the week, not only with engagement, but in meetings in Owen Sound or in Wyerton or in Toronto. We're kept very, very busy, and certainly as a busy place to work. So, any questions about the LHIN before we move into the panel presentation? We've got lots of exciting stuff to hear about tonight from our panel speakers. And again, think of some questions as the speakers present tonight, because I'm going to be looking to all of you to ask them some questions when they're done their presentations. So, with no further ado, I'm going to hand it over to Paul Collins, and Paul probably doesn't need an introduction here in St. Thomas, but I'll read the bio for Paul and then ask him to come up. So Paul is the president and CEO of the St. Thomas Elgin General Hospital. Paul's background is in quality and continuous improvement. He joined the hospital after serving in administrative capacities at St. Michael's Hospital in Toronto. He began his healthcare career as a respiratory thaerapist at the Oakville-Trafalgar Memorial Hospital in Oakville, Ontario. Paul is currently on the board of the Ontario Hospital Association, is chair of the Thames Valley Hospital Planning Partnership, which is a network of hospitals in the London region, and a member of the board of Toronto-based MedWorks Incorporated. He has a Master's of Business Administration degree from the Richard Ivey School of Business at Western, and is a certified healthcare executive with the Canadian College of Healthcare Leaders. So, thank you, Paul, for coming tonight.
Thanks, Michael. I appreciate the introduction, and welcome to everybody here to the hospital. Appreciate you all being here tonight. It's great to have you here, and it's of course great to have our LHIN partners hosting this session, and also a great privilege to be up here speaking with some of our local partners here in Elgin County and in London. We have a presentation that hopefully some threads are running through this. That each of us are kind of connecting the dots a little bit on some of the things that are where there actually are similarities and what we are attempting to do. I want to talk a little bit about things that there's lots of things going on at the hospital, but something that's very important is this Home Frst concept, and secondly about Schedule 1 and mental health, which is going to be, excuse me, a new program that we're going to be hosting at the hospital shortly. So, Home Frst. Now, for some of you may know about this, some of you may not, but one of the issues that hospitals face, which is a very large issue, is this business of what's called alternate level of care. ALC is the acronym that's used. But this concept, or this reality, is that we have folks who get admitted to the hospital for legitimate reasons, requiring some acute care time in the hospital, and when that acute episode has been completed, essentially when the care that can be provided at the hospital level is completed, typically most people are discharged either to home or to some other alternate level of care, like long-term care or a nursing home or a home with CCAC supports. What is happening in hospitals across the province, of course, is that this component of this number of patients are staying in hospital because those placements are not available in the community. So as we speak here today, we've got about 40% of the patients in this hospital, on the acute part of our hospital, that are ALC. So they are awaiting placement elsewhere. Many of them are long-term care, and many of them, because they have been here for a period of time, long-term care ends up being the most viable option. What Home Frst does is takes away this notion of long-term care becoming sort of the default. Very often in the hospital, patient presents and emerge, and within a very short time, decisions are being made about this particular person with their family or with them personally, and in conversations with our providers, that very quickly get to the long-term care as being the place where this person ultimately needs to go. Within sort of 24 hours of admission, that conversation's happened. Once that conversation happens, it's very difficult to turn the clock back. People start thinking about long-term care as an option, and of course long-term care is a difficult option to access. So Home Frst really revitalizes the home as an option. So the goals here are to increase, number one, the appropriate use of acute care beds in the hospital, to reduce premature placement in long-term care, because sometimes, many times, that is not the best placement. And finally, to enable patients to remain at home as long as possible. So The CCAC has partnered with the hospital team, and of course this is being very well supported by our LHIN, to collaborate on very specific measures and process changes and to fund the level of care required at home. So the kind of care that we're talking about at home is from the CCAC, or from the providers that the CCAC has built within their network, can be up from 2 to 4 weeks, 24/7 care in the home, which is a significant change from the typical sort of supports that had previously been available. So Home Frst has been initiated in the London Health Science Centre. St. Thomas is the next hospital for that implementation to occur. So we've started this process now. And so what we're trying to do, the keys here are to avoid planting this long-term care seed, hitting the default switch when people come into the hospital, because it's very hard to turn that around. To get very early CCAC interaction with the patient, so that's within 48 hours of admission, our CCA partners would have a conversation along with our providers with that patient and their family about the options. Use of screening tools and technology enablers that actually make sure that the right kind of decisions are being made cooperatively with the individual and their families. And so what we are looking at right now in terms of implementation is between now and September 2012. So it's really important, thank you, it's really important that we do this right. It's very much an integrated effort with our partners. And I think it's a very, very important development in the system to address this very difficult problem of ALC. So we are really looking forward to this. It won't do a lot for ALC patients who've already been designated in the hospital, but for new patients coming in, it's going to be very, very good. I mean, ultimately, they're going to have the kind of placement that works well for them. And for most people, people want to stay in their home, and that's what we want to happen for them. Let me just talk briefly then about Schedule I mental health. In 1997, the government made a decision. There was prior to that, the Ontario government essentially delivered mental health services through psychiatric hospitals, but they made a decision to divest those services to regular hospitals. And as a result, the decision was made to close the psychiatric building that we have down here on Sunset Drive. And we were told at that time that this hospital would receive 15 inpatient beds along with the outpatient programming that was actually being provided in that facility. So we worked over a number of years, 13 or 14, to get this program here, as well as a lot of other important enhancements and redevelopment that we believe we need. And finally, in August of this year, the Minister of Health gave approval to the hospital to proceed with our full redevelopment plan that includes Schedule I. It also includes a new emergency department. In fact, it's very hard to have an emergency Schedule I without an updated emergency department that can accommodate a mental health program. SPD, which is surgical sterile processing department, and some internal renovations. So it's a fairly big redevelopment. We have 2 concurrent projects right now. One is to bring the mental health program in here on an interim basis. That will happen in May of 2013. We will redesign some do some internal renovations to accommodate that program on a temporary basis till we can move it into the completely rebuilt facility that will be online come early 2017. So as we sit here right now, we're working very closely with all of our partners, including the LHIN, the Ministry of Health, Canadian Mental Health Association, St. Joseph's Hospital, who have governance for the mental health program now, to make this transfer happen. So it's a very busy time here at the hospital. We rely heavily on our partners in the system, as well as our community, to do the important work that gets done here. And I thank you for your attention. I think we'll probably just carry on with this speeches and have the questions and answers later. I think that's how you want it to go, Michael? Yep, good.
Thanks very much, Paul. And as Paul said, we'll have our question and answer session when we're done with the 4 speakers in the panel presentation. And I should have said off the top, I've had the benefit of working with all 4 of these leaders in Elgin County on a number of different initiatives, not always easy conversations that we've had. So it's a pleasure for us to have them here tonight talking about health services in Elgin County. Our next speaker is Heather DeBruyn, and Heather is the Executive Director for the Canadian Mental Health Association here in Elgin County. Heather's been active in the mental health field for over 25 years, and for the last 10 years has been the Executive Director of CMHA Elgin Branch. She has considerable experience around the provision of mental health services and has been active in the community in endeavors respecting mental health, as well as the housing of those with mental health issues and the homeless. Under her leadership, programs for those with mental illnesses have evolved in Elgin County. So let's give a warm welcome to Heather.
So as I stand up here, I realize not only have I not done a PowerPoint presentation ever before, so bear with me please. The microphone is something new as well. I'm grateful for this opportunity to talk about the different services that we provide here at CMHA Elgin, but also to let you know about the kinds of clientele that we work with, the very special people that we serve. So this is a profile of Elgin County. I'm sure that we all know about this already, and we know about the problems that we face here over the last number of years with the loss of thousands of jobs and the plant closures and institutions such as regional mental health care, downsizing, and all of this affects our entire community. As you can see, we have a high number of mental health clients, and the estimates are that it will continue to increase. A number of our clients have chosen this community to live in as they are attached to regional mental health care, and then as they move out into the community, find housing and supports in our community. We have been working with the seriously mentally ill here in Elgin for over 50 years. We started with volunteers from regional mental health care establishing the Canadian mental health. So we have gone and grown over the years, both in staffing and the number of clientele that we serve, with the long history of working closely with regional mental health care. What is it that we're hoping to achieve? We want to create a supportive community where people can achieve, manage, and celebrate mental well-being. We do that by supporting those who need someone to be with them and to work with them to their goals. It's always been a part of our mission to contribute to an integrated mental health service here in Elgin. We provide well-rounded and supportive community-based mental health services, and we also try and promote mental health through education advocacy in our community. I have pride in Canadian Mental Health Elgin, and we strive to work with our clients with integrity, guided by their best interests and with the greatest respect for who they are and what they have come to us for help with. Our staff display compassion in the relationships with our clients, and we work hard to ensure that our services are fully accessible. Who do we serve? We serve individuals with serious mental illness. Last year, about 1/3 of all the residents of Elgin with a serious mental illness were our clients. They suffered through disorders such as schizophrenia, psychotic disorders, and mood disorders. How do we serve them? We provide a wide range of services to the clients, as you can see. And just so that you know that it's important to understand that the people we serve are real people. They're part of our community. They're not just statistics and demographic units or consumers of service. They're people who have significant problems who we work with every day. Some days the issues that face them tear at my heart. And so we do what we can do to help make it a better place for them. We work with them so that We know that they have names and individual issues, but they are no different than you and I. They're our neighbors, they're our friends, they're our families. We're not a lone ranger in the mental health services in Elgin. We work together with others to try and get the best services for our clients. We work with the hospitals, the community health centers, the medical centers, and other agencies such as the Mennonite Resource Center and the homeless shelter. If we can establish a partnership that will improve the services for our clients, we pursue it. That is part of who we are. And it's true that alone we can do so little, but together we can do so much. The capacity report has come to the LHINs and has been outlining a number of service priorities for Elgin. In Elgin, we need to continue to develop a coordinated model of care for mental health in Elgin. We need to further develop community psychiatry with services here in Elgin, and there is a need to work more on treatment for the complex trauma and the familiar story in Elgin. There is always an issue around access to services. Unlike other centers, particularly the large urban centers, we need to use our own model for accessing services due to the limitations within a rural and small town. Sorry, I got distracted by the sign. One of our great successes here in recent time is working together with a number of different organizations to develop the Focus Fairview project. Out of working together and bringing all the services locally to this housing complex, they have reduced the number of calls to the police by 50% over the last 2 years. And I have a lot more slides. The capacity report has recommendations around restructuring the networks within which we work. It will provide better service for our clients. That's a tremendous opportunity. We have always worked to be accountable, and multi-service agency accountability agreements will allow us to do the work that we need to do with other mental health organizations and provide the best services that we can provide for our clients here in Elgin. We look forward to studying the opportunities that may arise that will come over the next little while working with the LHINs. Throughout this process, the primary focus must be to improve client care for the clients in St. Thomas and Elgin. One of our ongoing issues over the years is that we have always been policy rich, but resource poor. We know what we need to be doing, and we know what the clients need. It's a matter of being able to get enough staffing and resources to be able to do those things. Our sector has been under-resourced for numerous years. Our caseloads are high and getting higher, and the community is concerned that people are falling through the gaps. That is of great concern to us. If we could provide services for the moderately mentally ill, perhaps that would prevent, at times, some of the illness turning into a severe mental illness. Why is there a need to change? There's a need to change because we want to do what is best for the individuals we serve every day and those who may be in our community who could use our help. These are our new partnerships and collaborations. We have started to undertake new partnerships and collaborations within Elgin. This is the Elgin approach. It's that if we need to get together to help solve something, then we come together and try and bring the people together to answer the questions and to provide the services. We've already begun the process. If we're able to work together in partnerships, then that will achieve progress. Throughout it all, as we work together, we will have successes. Thank you.
Thanks very much, Heather. And originally we had Bill Lee as a client with CMHA Elgin. He was going to give a client experience from at the end of the presentation, but maybe it's best that you come up now following on Heather's footsteps and you can do your presentation right now. So welcome, Bill.
As you know, in St. Thomas or Elgin County or the whole world, people are suffering with mental illness. I had suffered mental illness from 1967 to 1974. I couldn't remember from day to day. I had epileptic seizures, and I took a nervous breakdown. But when I started joining the Association for Community Living, it changed my life a little bit. They helped me through where you're supposed to. But then when the Association for Community Living changed to Development Challenge, I didn't know where to turn. And then all of a sudden somebody said, "Do you know CMHA?" I said, "What does that stand for?" Canadian Mental Health Association. Oh, I said, okay, then I will join this CMHA, which my wife and I joined the Canadian Mental Health Association, which there's lots of programs, 5 to 6 times a year. There's trips going on once a year, our annual Christmas party, and this is where we're supposed to do it. That we're supposed to be here to help people, not to look down on people and say, "I don't want you anymore." That's what I felt for 8 years. When you're going through this program, you don't want to, nobody wants you, nobody recognizes you, so what do you feel like inside of yourself? You don't know who you are, you don't know what to do, so you just put yourself to nowhere. But when people start recognizing you through associations and things, this is what happens to me and my wife. We feel so good that we're welcome everywhere in this world. And then when I started in 1996 with the Patients Council, I have experience with mental illness, that I will do my stuff and I will help people. There are so many people in this community that needs so much attention, that does not want to get out and do anything for themselves. They just want to sit there and do nothing. This is where we have to put in, that we need the associations to do everything for everybody. So this is why I say that, get yourself involved, don't sit around. That's what I did, and I belong to so many organizations today, and I feel wonderful that I don't look back in the past, I look towards the future. And so everybody, keep up the good work.
That's a great message, Bill, so thanks very much for coming and delivering that, and certainly is an inspiration for all of us here, no matter what sector we're representing tonight in the healthcare business, so thanks, Bill. Our next speaker is Gordon Milak, and again, I've had the opportunity to work with Gord for a number of years, and Gord has experience here in Elgin County as well through the VON. He's the Senior Director of Performance Management and Accountability with the South West Community Care Access Center. And Gord may say this in his presentation, but the CCAC has the same boundaries as the LHINs. So our South West LHIN has the exact same boundaries as the South West Community Care Access Center. Gord has over 25 years of experience in operational leadership with community pharmacy and home care. Prior to joining the CCAC as quality lead, he was Executive Director for VON Middlesex Elgin in the Chatham-Kent branches. He has a proven track record of building strong relationships and partnerships with stakeholders and is a champion of innovation, quality improvement, and transitional management. His community experience includes co-chairing the Southwest Quality Advisory Group and membership on the Salvation Army Community Advisory Committee, end-of-life planning committees, and the St. Joseph's Healthcare Board Quality Committee. So please join me in welcoming Gord.
Good evening, thank you. Yes, it's true as Mike said. There we go. What Mike said is true. I know the drive from certainly St. Thomas to Owen Sound and Wyerton, to be sure. It's a big piece of ground, and we know most parts of it fairly well. The CCAC, there are 14 CCACs that cover the province, and we do match the LHIN boundaries. We are a local point of access for community-based health care, funded by the LHINs, and we are governed by volunteer boards. In the Southwest, we have 7 local offices, as well as we have an office in each one of the hospital sites. What we do is we help people connect with the care that they need. So whether it's to recover in the community from illness or injury or treatment in a hospital, our goal is to help people live independently in the community for as long as they are able. When the time comes to assist them to die in the location of their choice with dignity, and to make the transition to long-term care or other settings as is required. And children represent a fairly large part of our caseload, supporting them with chronic or other disabilities. This year, we will provide more than 2 million visits to over 50,000 people that reside in the Southwest CCAC LHIN area. Every month, we are not involved in every hospital discharge, but where the discharge involves needing care in the home or in other places, we are. And every month, there are 2,000 people that we would support through the hospitals across the Southwest. About every month, 260 clients are transitioned into a long-term care home, and about 5,000 referrals for home care services, as well as referrals to support clients who need community support services. And we also help people connect with primary care or family doctors. In a little over a year and a half, the CCAC, through the Healthcare Connect program, about 10,000 individuals, across the Southwest have now been matched with a family doctor. So Paul did a really good job talking about Home Frst, and I won't repeat that. But it really is about working in partnership to enable an individual to live independently for as long as they can. Decisions to move in a long-term care home are a big decision for the individual and also for their families. And big decisions like that are not best made when you're under stress or in an urgent situation. And so doing that from the comfort of your own home, when you can really consider the options, is really best. And the plan of 2 to 4 weeks, as Paul has already identified, has been a way to help clients not just come home, but also to stabilize and in many cases rebound. And as they've had the opportunity to do that in the comfort of their own home with their family around, they've been able to actually make very different choices than they may have thought were possible. As an example, here's a person whose name's been changed for the privacy, of course, but Maria, 80-year-old individual with dementia, was hospitalized and was suffering from seizures. She was in the hospital for almost a month due to complications and became really very confused. But with the Home Frst approach, partnering with the hospital providers as well as the CCAC and our service providers in the community, she came home to stay in her daughter's house. And with that care, she was able to come home and greet her dogs by name. She was able and continues to be able to remain in her own home. And so long-term care may be something she has to consider in the future, but not now and not because of the hospitalization. When long-term care is necessary, the CCAC is there to help. And our role is really to facilitate the process of a client making the decision to move into there. Long-term care homes and the process to be placed there are both regulated by the province. And it includes, the regulation really is quite robust. It helps identify all types of details such as eligibility, priority access, waiting list, all those sorts of things are all taken into consideration. When somebody moves into a long-term care home, there is a cost. The room and board, really it's like a landlord-tenant arrangement, and the client would pay their own room and board, and those prices are listed based on whether they choose basic, semi-private, or private. Of course, the health care that's involved and the personal support, those things are covered through funding by the ministry through the LHINs. And ultimately, depending on which home is chosen, the wait list can be very different, and it also depends on the individual's choice as to where they may want to reside. Again, the decision to move into a long-term care home is not one to be taken lightly. It's like selling your home and moving to a new community. You are giving up your home. You may be moving into a room where there is somebody else that you don't know. So it's not an easy transition, and it's one that needs to be taken with great consideration, and one that involves other family members as well. Time won't permit, but the healthline.ca, which is a health and consumer portal that supports and lists all the services across the Southwest CCAC, has actually worked with all 76 long-term care homes, and they've done videos. And so if there was time, I'd put this link on, and we'd see Beauvier Village, and you'd see all the services that they do. What this does is, first of all, the client can actually view all of the homes that they might be interested in, but it really helps the family members too. Sometimes there's a family member that lives outside of the area, and for them to travel and go and see these homes can be a really tough thing to do. Now there's a virtual tour, and it helps families maybe narrow the choices in terms of the numbers that they really want to go and visit in person. It's probably still a good idea to go and see it for yourself, but this helps certainly a whole lot better than just looking at letters on a printed page. Another service, and linking back into the mental health theme this evening, is about the behavioral support systems that are in the Southwest. The aim of this collaborative, and it really is a collaborative of many partners right across the Southwest, is really to help older adults that have responsive behavior issues that are living in the community or long-term care get the supports, and the folks that are supporting them to have the resources that they need as well. There's two primary parts to this. One is a SMART team, which is a specialized team that goes out to support those individuals and their caregivers. And then also about funding for staffing, additional staffing in long-term care homes that can also support those that are in the community. There's several pillars in the framework on this collaborative, and it really is about system coordination and management, developing an integrated service delivery model, and having that intersectoral and interdisciplinary, having all the providers that are involved working as a team in a coordinated way to really provide the maximum benefit for the individual involved. And it's also about evidence-informed education and knowledge transfer. What are the best practices? What are the leading practices? And how can we make sure that all the folks that are in our region are benefiting from that latest research to the very maximum effect? Directions that have emerged so far is that there is designated funding for long-term care homes that will provide behavioral support units, the response, and again the SMART teams, which have already identified. But it's also about the additional healthcare personnel that are in the long-term care and that can also support those that are living at home. There are LHIN-wide supports that are in place that include a geriatric psychiatrist, psychologist, improvement facilities, etc. And working with other really important partners in the system as well, such as the Alzheimer's societies and that First Link program, which is so important to this group. And adult day programs that also provide really important respite for family members, including the option for some overnight and weekend respite. And that's it. Thank you.
Thanks very much, Gordon. Our final speaker tonight is Judith Wiley, and Judith is the Executive Director of the Central Community Health Center, which is the newest, I guess it's one of our newest, because we have one new one in Markdale as well, which is in Grey County, and the Central Community Health Center is on Talbot Street, is it? The main drag of St. Thomas here, sorry. So Judith's bio, although Judith began her career in the corporate sector, it is the non-profit sector that captured her heart. After her time at the YWCA St. Thomas Elgin, Judith was lured to the national YWCA, where she became Director of International Programs and then National CEO. From there, she spent several years as the CEO of the Canadian Society of Association Executives, followed by an entrepreneurial stint owning her own consulting business. Judith's expertise in non-profit management and governance has taken her pretty much around the world. Most recently, she worked with the governments of Trinidad and Guyana to help improve the management of their various ministries and towns. And maybe the most fun was living in Barbados, where she worked with Caribbean Development Bank on a change management project. Very exciting. Now she feels privileged to return to Elgin in the Central Community Health Center as their Executive Director, and I know you had a big announcement today that I'm sure you'll tell the group about. So welcome, Judith.
Thank you, Michael. It is a pleasure both to be back in Elgin County, but also to share the podium with my very respected colleagues. Central Community Health Center has been open for just a year, and already we have very innovative and energetic partnerships with many community organizations, including some who have already spoken. So, there's my little flicker here. We'll see if I can get this. Michael, I might need your help. I did. Ah, there we go. Okay. So what exactly is a community health center? The community health center is a charitable organization that is governed by a community board of directors, and it provides primary health care, so doctors, nurses, nurse practitioners, but also programs that promote health, that promote illness prevention, and community development services. And I hope by the end of my presentation you'll see how the Community Health Center weaves in with these other organizations and supports the sorts of things that they do and complements the kinds of things that they do rather than have any kind of direct competition. Our vision is to work in the communities of St. Thomas, Central Elgin, and Southold in the pursuit of good health and wellness for everyone. Who runs? Oh, I should tell you, we have a set of core values, and when you get the presentations, you'll see all of this. I don't want to just read and read. But one of the primary core values, which is the same as every other presenter, is to have the community and the client center. That's our focus. And we take our direction from our clients and from our community and what are those needs. So who runs the Central Community Health Center? It's run by a board of directors, a voluntary board of directors, just like the LHIN. We have a very active nominations committee that works on and off during the year to find individuals with specific skills, with the time and with the energy and the commitment to health and wellness, who can give us that time that we require. Our community health centers new.
8 p.m. visiting hours are now over. Thank you.
Anybody who's visiting, you can leave now. Community health centers are not new. They've been in existence for about 35 years. If my numbers are correct, there are 125 community health centers throughout the province, and we are one of 22 new centers that were announced in 2005. We are not an emergency or walk-in center. Primary care and support services are provided at the center to clients who are registered with Central Community Health Center, and clients need to make an appointment to see a primary care provider. That being said, by being present in the community, we do hope that we take the burden off, especially emergency care at the hospital and also off the walk-in clinics. So how can I become a client? Health services are available for people living in St. Thomas, Central Elgin, and South West Township who do not have a primary care provider. In other words, they don't have a doctor, a nurse practitioner, or a nurse. We currently have a waiting list of over 400 clients, having registered about 1,300 in our first year. The reason we have a waiting list is because we're trying desperately to hire more doctors and nurse practitioners. So if any of you know of doctors who are maybe semi-retired, would like to give us some hours, or new residence graduates who would like to come and try their hand at our center, please send them along. If you would like to add your name to the waiting list, please come and see us at 359 Talbot. We expect it'll be about 3 to 6 months before we can work through the entire waiting list. And what type of health professionals provide services? Aha, wait a minute, let me go back. I have to hold that one in abeyance for 1 second. We have, as I've already said, nurses, doctors, and nurse practitioners, but we also have a dietitian, a chiropodist, we have 2 social workers, we have a community outreach worker who does a lot of work with youth across the catchment area, and we have a health promoter. And I want to talk about those for just a second, because we're thinking about primary care. We're thinking about how you get your checkup or your inoculation and so on. But we offer a full range of services, and it's some of those services that are at least as important, maybe more important than the primary care. And in relation to the kind of conversations we're having this evening, sometimes they are more important. So for instance, we are working in collaboration with CMHA, with Public Health, and some other agencies to offer a postpartum depression group. We have walking groups for seniors. We have senior support groups. We have groups for people with anxiety or depression, just support groups, so that many of our clients have what Heather was referring to, not severe mental illness problems particularly, but if we can catch them earlier, if we can give them the support, maybe they won't get to that stage where the problems are severe. And the advantages, not just for the individual, but for our community as a whole, are enormous. So we have a wide range of programs, and as I said, those are determined by our community and by our clients, and in consultation with other organizations. And so Michael alluded to a special service, and that is our mobile health unit, which we just launched today, actually. So watch for us on the road. We say we're on the road to serve you better. And this is quite an amazing unit, which has been, about 3 years in the planning, etc., but 10 months in the actual building. So today we launched it, and I have to tell you, I was very relieved. There were days I thought, I don't know if this is ever going to happen, but it has, and it's fully laid out to be like a doctor's office, but it can also be used by the chiropodist. It can be used even as dental. The chair and the bed and so on are all adaptable. And we have been in conversation across our catchment area with various community groups and service providers, so that maybe what will happen is we'll pull up the unit, people will get their checkups, their inoculation, their chiropody treatment, whatever, but we'll be in the community center doing youth programs or senior support group, or our dietitian will be giving lectures and talking to people about healthy eating. So we're very excited about that. Many people ask if they have to pay for our services, and the quick answer is no. Like all the other agencies, we receive our funding from the LHIN, and our services are free to our clients. At present, our hours are 9 to 5, Monday to Friday, but we are looking now at extending to Thursday evenings and potentially Saturday or more each month. And again, as our clients determine what is the need. So I do want to say a quick thanks to the LHIN. We've had a very exciting year as we got our organization up and running, and we've depended on the LHIN staff and board for a lot of support, and they've been there. So thank you very much, and thank all of you for coming out and showing interest in healthcare in our county.
Great, thanks very much, Judith. Now it's your opportunity to ask any questions that you have of our 4 panelists. You've heard lots of great information about healthcare here in Elgin County. You can also ask any questions you may have with the LHIN, to myself, or to our board members, so the floor is yours. Maybe I'll kick things off. There was the comment about the common thread amongst all of you, and I think Home Frst was mentioned by almost all of you. And Home Frst is ensuring that the ultimate destination for people is home. So people don't want to be in hospital, they don't want to be in long-term care, they want to be in their own home. So Home Frst you saw coming out in Paul's presentation with the CCAC, with others, the supports that CMHA Elgin provides, the supports that CHC, or the Central Community Health Center provides. Maybe one of you, if you could answer how the 4 of your organizations work together. So how do you ensure that there is that common thread in Elgin County in working together and providing health care for the residents here?
I have a lot of nerve as the new kid on the block to take on the answer. However, one of the things that drew me back to Elgin is how engaged the community is in programming and in care for people who need care. And Heather spoke about it. I think Paul spoke about it as well. People in this county really care, and there are committees across the county of people working on issues, mental health issues, housing, youth at risk, addictions. So that's us. We're all there. We get together on a regular basis to talk about the needs, to talk about some potential solutions, to share with each other what we're doing, how we're doing it, what kind of challenges we have, so that we can offer solutions for one another. So I think pretty much we have a good idea of what's going on We also, from time to time, do what we call in-service. So I might call Heather or any other service provider and ask them to come in and talk to our staff about what the services are, how our clients can access them, and so on. We're involved in studies through public health, through strategic planning for any other organization, etc. So I really feel that that we know what each other are doing. And I yet have not found an organization that's not really willing and keen to work together for the betterment of the client.
Yes. I'll give you the microphone.
Oh. Sorry. May I ask more than one question?
Hey, we only got 20 minutes here.
Okay, we'll ask 1.5. Yeah. It's to all, actually. How did the public actually become aware of all these wonderful services that are available? Who do they contact? Is there a central location you can phone and say, I believe I need this service, who should I go to?
Great. I'll let Gord start this one, because I think there's a good starting point.
Yeah, there's really two ways that the CCC connects. A big part is when somebody is coming home from hospital. Probably half of our clients would be referred to us at the point when they've been admitted, and we're helping with the discharge. The other half are referrals from the community, and so those can be self-referred. We have a website, and if you're in the emergency department, we have folders there that give information about accessing us, and in many physicians' offices, the folders are there. When you call, what happens is we provide an assessment of what, we try to find out what your needs are, and then connect you with those services. And a lot of times it's not just about home care, it may be about connecting you with another community-based service that is in the community where you live.
Thank you.
And maybe a bit about the healthline.ca.
Yes, the Healthline is really an exciting resource that we're very privileged to have here in the Southwest. It is going provincial, as a matter of fact. It's been identified as a best practice, but the healthline.ca, all one word in lowercase, allows you to get information, health news. There are a whole bunch of different options on here, so you can go on there and do some self-navigation if you've got questions about different services. But there's also like a workopolis that's there. So healthcare providers that are looking for work and those that are recruiting share their best practices so that we keep all the very best and brightest providers working in the Southwest area. There are also mini sites, things like children's. There's a really great children's website there. There's other things, resources for providers, things like wound care best practice, but there's also some directly for clients and caregivers about support groups that are in the community, and it's all free for organizations to either post their information there or to link to their own website. So it's not duplicating, but it is one place where you can then connect with the others in the community.
Thank you. Sorry. The other one I have is for Mr. Collins, and it's to do with Home Frst. I think it's a great program whenever we do get it off the ground, but obviously there have been studies done to its value to the clients, the customers. And perhaps you don't have the answer right now, but what percentage difference is there between the cost of taking care of these clients at home, 24-hour service, you referred to it, as against keeping them in an LTC or in the hospital in the acute center? Is there a percentage difference of 40% in cost, or is the percentage difference in the quality of care that these clients will get? Thank you.
Yeah, thanks. That's a great question, and there's people in this room that are much better at qualified to answer that than I am. But I would say there's a number of elements of cost here. You know, it's you know, you can certainly look at the dollars and cents, and is that 20%, is it 40%? But you might argue that some of those costs are sort of social and to the system. I'll give you an example. You know, at one level, somebody who has to stay in the hospital because there is no alternate placement for them outside of the hospital where they can stay. There certainly is a cost there to that individual. Hospitals are not the safest places to stay in. I think hospitals are great places when you're sick and you need to be healed and you need to have an intervention of some sort, and when that's finished, it's a good option to be moving on to the next level of care, the next level of services provided. To stay in the hospital, we're not geared to look after people over the long term. It's best, you know, for that individual to move on. It's best for that individual if they can move on and somebody else who requires acute care, that bed is then available for them. So I think there's a social system cost there. And then, of course, what is really great about this Home Frst option is what they're learning, and I think Gordon referred to this, what they're learning is that these folks, when they go home, and possibly that's the best place to make the decision for long-term care or some other need, but even though they have this 2 to 4 week period, you know, that you can, that they'll provide 24/7 care, the reality is that not many of the folks who actually end up in that particular service require that. They find that they're just the idea that they can have it, that it's there, that it's intense for a period of time, helps them to recover, just like the case study of Maria, where, you know, she's able to stay in her home, still able to stay in her home. So, you know, I'm not sure of the actual cost, and maybe Gordon or Michael would be better to answer that, but I will tell you the system cost and the social cost is very high to not taking advances like this that I think are really important in our system.
I don't know, Michael. Thank you very much, Gordon.
Yeah, I think it's early to actually put a hard number to it, but there is a savings. Again, those clients that come home after the 2 to 4 weeks, some still need to go to long-term care, but they're able to make that decision from their home, which is best. A number of others need some other services, such as supportive housing or assisted living, which help them in the long term. And some recoup, like Maria, recoup enough to go to a normal home care service plan, which is significantly less expensive. But yeah, it's the whole basket of value. First of all, it's the outcome for the client, right? That's in there, but it certainly has some value. But we are working on what those numbers will look like, and there are some definite fiscal savings in the process as well.
Thank you very much.
Great, 2 good questions. Here, we'll go to one behind you first and then come back.
Oh, excuse me.
No, that's okay.
Paul mentioned that the Sunset Drive Hospital was closing and mental health coming to St. Thomas Elgin General. What's happening with the site beside the hospital that's closing?
So Paul gave a component of a larger divestment process which is taking place from the former London Psychiatric Hospital and St. Thomas Psychiatric Hospital, which are now Regional Mental Health Care London, Regional Mental Health Care St. Thomas. So there's a number of beds, long-term specialized mental health beds, which are moving from St. Thomas and London to other communities. We've already had 50, I believe, that have moved to Kitchener-Waterloo. That transfer took place about a year ago now. 59 beds have transferred from St. Thomas in London to Windsor. There's an additional 14 beds, and these are long-term specialized mental health beds that are moving to St. Thomas. And then there's 2 new facilities that are being built in in the Elgin Middlesex area. There's a new facility being built on the Parkwood side of London, which is for long-term specialized mental health beds. And then there's the new facility being built on Sunset Drive, which is the forensics unit, which will house those forensics patients that are currently on the St. Thomas Psychiatric Hospital site now today. The 15 beds that are moving from Regional Mental Health Care St. Thomas to the St. Thomas Elgin General Hospital are what we call Schedule 1 beds, and so they're shorter stay acute mental health beds. And those 15 beds, as Paul said, are going to be going into, on an interim basis, into an existing wing of the hospital, and they're intended to be up and operational by 2013. With the larger redevelopment going on at St. Thomas Elgin General Hospital, they'll be incorporated into that larger plan, which is, I'm not sure the time frames. Early 2017. So it's a large divestment process that's ongoing, but there are 2 new facilities being constructed, one here in the south of St. Thomas there.